Hey guys, good morning. This is Luis Moreno with 360 Insurance Group. I'm coming to you with the latest and greatest on ACA. I just got a notice that the family glitch was gonna get fixed for 2023. So I'm gonna explain to you what the glitch is and how it affected us in the past and what we're gonna be able to do with it in the future. Guys, open enrollment starts November the 1st. This family glitch issue is going to be taken care of, which means we're going to be able to write a heck of a lot more insurance going forward. So I'm going to give you some quick details on it, and then I would do a subsequent video where I explain the actual details. But this is huge for us, guys. We got to take advantage of this. The numbers are crazy as to how many people are now going to have access to ACA plans and possibly receive subsidies if they qualify. So check out the article. Okay, so what I'm sharing with you here is on the applications. This is a question that was asked, and this is what caused the family glitch. The question here on the application is, will any of these people be offered health coverage? The key word here is offered health coverage through a job, including another person's job like a spouse or a parent. Okay, this is huge, guys. Big issue here. So what was happening here is if one spouse had coverage, okay, and the other spouse was not insured through the plan because it was too expensive, or the kids were not insured through the plan, okay, a lot of times what they try to do is they try to go on healthcare.gov, request a quote, and also qualify and try to get subsidies if they qualified for it. Well, the big issue here was that if they were offered coverage, this was not able to happen. Okay, so they were not able to get subsidies. The consequences to getting subsidies is that they potentially could have had to have paid those subsidies back, okay, in the form of a tax liability. So not a very good thing for our insureds. Okay, so this is the fix. So we're going to review the article here so you can have an idea of what we're talking about. Okay, so healthcare.healthinsurance.org, great organization that puts some information out. So here is the article. The IRS regulations fix the ACA's family glitch as of 2023. So what this means is that during this open enrollment that starts November the 1st, we're going to be able to insure the spouses and the kids, even though the other spouse has coverage through work, and possibly qualify for subsidies. So with this new IRS rule, some families will be newly eligible for premium subsidies. All right, so let's kind of read through this thing. So most employers offer health coverage, okay? And what happens is when an employer offers health coverage, they are able to, or they're required to pay 50% of the employee-only premium. Now, some employers pay more, some employers pay towards the spouse and the kids, but most employers usually only pay for the employee-only premium. So the issue here was that if the portion of the premium that the employee was paying, their portion, not the total premium, their portion did not exceed a percentage, 9.61 of their household income, the plan was deemed affordable. Therefore, the spouse and the kids could not get subsidies on the marketplace. So they were penalized. And I tried helping our insureds with this. And normally, I would say 9 out of 10 times, the plans were deemed affordable. I was not able, or the portion that they were paying did not exceed 9.61% of their income. So that threshold was never met. And because the threshold was never met, the family who was trying to get a plan on the marketplace could not get any subsidies. Okay, well, now that has gone away. Okay, so the family glitch refers to the fact that from 2014 to 2022, when the affordability of the employer sponsor plan was determined, it was based just on the cost for the employee. Okay, just the employee cost, that's it. The cost to add family members was not taken into consideration. which was huge. But the affordability determination was then applied to all members of the family who could be added to the employer-sponsored health plan. So they never took that into account. Okay, the threshold for this year and the past years has been 9.61% of household income, which means you've got to take the spouse that's on the income for the spouse that's on the employee plan, plus the income of the other spouse and the income of any kids that are in the household. So all that, if the employee only premium, not the total premium, the portion that he or she pays, the employer matches 50%. You cannot take that 50% into account. It's the other 50%. If that did not exceed the 9.61, it was deemed affordable, no subsidies for that family. Okay, well, now what they've proposed, so let's keep on reading here. It doesn't matter how much the employee would have to pay to purchase the family coverage. The family members were not eligible for exchange subsidies if the employee could get employer-sponsored coverage just for him or herself for less than 9.61% of the household income in 2022. As long as the employee's portion, remember, that's the key word here. A lot of agents make this mistake and they counted the entire employee premium. Okay, we're referring only to their portion. Okay, not the 50% that employer is matching. Okay, the cost, if it was deemed affordable, no luck. Okay, so let's continue here. So as long as the employee's portion of the premium is affordable, the cost of the family could have ended up being 25% or more of their household income, and they still would have no access to premium subsidies. So for those of you that don't know, when you go add, and I've got several groups in my book, and a middle of the road premium for an employee is maybe about $500 a month for an employee. The employer pays half, which means the employee pays $250 and the employer matches the other $250. Okay, so that makes up the $500 for the employee only. Now, when you go add kids, rate would probably go up to about $1,200 or $1,300. If you did a family plan where you added the spouse and the kids, maybe $1,700. Okay, so what happened is a lot of employees just didn't have the funds to insure their spouse and their kids, so only the employee would get insured. Okay, now you cannot take that $1,700 and use that as the calculation. That's what was screwing this entire thing up. What has happened now? Okay, so soon after taking office, let's see here, let's get to this thing. Here's what's happening, guys. This is where this is going to go. The rule change is fairly simple and straightforward. Instead of basing the affordability determination for a family's employer-sponsored health insurance on just the cost to cover the employee, the determination will now be made based on the cost to cover the employee plus family members. That is huge here. So we're going to be able to take into account the entire premium for the family. Guys, huge opportunity here. If the family, okay, so let's continue here. The family glitch will be in effect as of 2023. So when families apply for 2023 coverage during the open enrollment in the fall of 2022, the new rules will be used to determine whether anyone in the household qualifies for premium subsidy. This is huge, guys. If a family has to pay more than a certain percentage, which has decreased now to 9.12% of for the employer-sponsored plan, they will potentially be eligible for premium tax credits in the marketplace. So, guys, this is huge. Here is, there's you can continue reading this article. I will post this article in the description below. But guys, we've got to take advantage of this. So there's a lot of information in this article, a great article to read, but just know right now that we have the opportunity to write a ton of business. Here is some numbers here. They're saying roughly 5 million people have been affected by the family glitch in the past. Guys, this is a huge opportunity for us to help a lot of these insureds and for us to make a great living. So with that, guys, do me a favor, subscribe to my channel. like this video, post some comments, and stay tuned for the next video where I will get into details on how you can do the math to figure out whether the plan is deemed affordable or non-affordable so that the insureds can get subsidies.